I am a passionate believer that every veteran should have the right to see any doctor you choose. It should be your decision. So if you want to go to the VA, that's your right. You've earned it, you bled for it, and you should have that right protected. But if, on the other hand, you want to go to the local doctor down the street, if you want to go to the local cardiologist, you should have the right to do that as well. Giving veterans choice, real choice, robust choice, the biggest benefit of that is that competition is the one thing that we can count on to improve the quality of care in the VA, to shorten waiting times, to make the VA more competitive, because if veterans have the power to choose the healthcare professionals that you want to see, that empowers you and it improves the whole system.
You keep going over and saying choice, it's the veteran choice. It's actually not the veteran's choice. It's a community-delivered network, just like an HMO or a PPO. So that means someone decides the doctors that are in the network. So it isn't a veteran has carte blanche to go to any doctor.
Right.
It's a doctor within the network. I think that it's very short-sighted to tell veterans that they have a choice and get veterans all on board to support the choice when it isn't a choice. It's actually a community-delivered HMO or PPO style where you go to the doctors within that network.
You all on the Hill are scaring the living daylights out of us. The insurance companies can opt out of paying for health care, mental health care. Then who's going to pay us to do that? And we have to get paid. We can't just provide services for free. And so what are you going to do to help make sure that mental health care services are reimbursed at a proper rate so that we can continue to provide services for veterans?
In the VA world, when it comes to choice, there have been persistent problems in the existing choice program about reimbursement rates for private providers not being sufficient, about extensive delays in reimbursements where private providers take on veterans, provide the care, and yet getting reimbursed can be month after month after month. That's something that I'm trying to press individually, different VA facilities. That's what I meet with leaders. That's something I'm pressing on, and it's something we need to see throughout the system, a greater speed in reimbursement, a fair and reasonable reimbursement rate. That's all part of, I believe, the gradual improvement of the choice program.